Hello, I hope you are well. In this video we will see what were some very special emergency surgeries. Welcome to the question answer channel. The channel where you will find the answer to everything. Thanks to Luise, Amelia Andiamo, James Pearson and Lou Davis for answering this question. We'll start with Luise's first answer.
June 1995. Doctors Angus Wallace and Tom Wong were waiting for their flight from Hong Kong to London. At the counter, they were asked to take a brief look at a woman complaining of pain in her arm, presumably after a fall. After takeoff, the plane's doctors went to see the woman to put a support on her arm. But they found that her injuries were much more severe than she had initially reported. The woman not only had broken arms and ribs, she had a pneumothorax, which means that air escapes from the injured lung and gets stuck between the lung and the chest wall. Such a condition is usually life-threatening if left untreated. Wallace believed that changing the air pressure on landing would kill the patient. Therefore, Wong and he had to improvise. The emergency medical kit on the plane contained lidocaine. This is a local anesthetic, but the catheter in the kit was intended to be used only as a urinary catheter and was therefore too soft to be used as a chest tube. So the two doctors made a trocar with a metal crutch to stiffen the catheter. A trocar is an instrument that can be used to create access to a body cavity, e.g., abdominal cavity, chest cavity. They made a check valve from a water bottle with holes in the lid. They sterilized their equipment in excellent Courvoisier cognac and began the operation by making an incision in the patient's chest. Of course, there were no surgical forceps available up there. Therefore, Wong had to hold the incision open with a knife and fork while Wallace inserted the catheter. The entire operation took about 10 minutes. The doctors successfully released the trapped air from the patient's chest. The woman survived the rest of the flight without complications. She ate something and watched movies. Later, Wallace and Wong published a short article about the incident in the British Medical Journal. Wallace later testified before a parliamentary committee. He was very critical of the equipment on American Airlines planes. He said he probably would not be able to help aboard an American plane. This, he said, is because typical US airline emergency medical kits do not even contain aspirin. He stated, there is a need for fundamental change in this regard in the United States, both on the part of the government and on the part of the airlines. Unfortunately, I cannot report anything about the situation on German planes. Sources: Wikipedia. Boing.
What do you think? We will continue with Amelia Andiamo's answer.
Not a full surgery, but I've decompressed a punctured lung. An old lady fell during turbulence and landed directly on an arm rest. She had an almost perfect pneumothorax injury. I had a stethoscope in my carry-on bag and used a bamboo skewer. Thanks, Homeland Security. My nail file is a deadly weapon, but the airline can take a bucket of skewers and metal cutlery. The whole thing sounds exciting, but it was very sedate. TBH, I was more annoyed about not being able to watch the last half of a really good movie. In case you were wondering, Malaysia Airlines Kuala Lumpur to Los Angeles, never found out how she turned out, the way starring Martin Sheen.
We continue with James Pearson's answer.
Then you be honest with the surgeon and his staff and tell them what medication you are taking and ask if it will be a problem. Some medications can cause problems during surgery, either by reacting with anesthesia or by causing excessive bleeding. It's your life and health and you want surgery to be as uncomplicated as possible.
We continue with Lou Davis's answer.
Many years ago, a patient arrived in our emergency department having been stabbed in the chest. It became apparent that the wound was likely to have damaged the heart. We contacted the cardiothoracic team and prepared to take the patient to theatre for urgent surgery. It was the middle of the night. The team would have to travel from home. An additional complication was that our hospital did not, at that time, have the equipment required. A surgery of this type usually took place at a separate hospital a few miles away. But the patient was deteriorating rapidly. As we arrived in the operating theatre suite, we were met by a group of orthopedic surgeons who had been operating on a patient late into the night. One of them was South African. They obviously sensed that things weren't going well and asked us what was wrong with the patient. I don't recall what we told them, but within seconds that had taken the patient from us and gone back to the operating theatre with him. The South African orthopedic surgeon opened the man's chest, repaired the hole in the patient's left ventricle and was closing the chest when the cardiothoracic team walked through the door. It transpired that he was adept at procedures like this, having worked in a busy South African trauma unit for some time. I doubt that this would happen now. The bureaucracy would prevent it.
This is the end of the video. Thank you for staying until the end. If this answer helps you, please help us too by leaving a like and subscribing to this channel. It allows us to move forward on YouTube. This is now the end of this video. Remember to leave a comment to tell us if these answers resonate with you. Bye and see you soon.